The practice of medicine, for all its advances, remains an imperfect science. Diagnoses are frequently made based on observed symptoms, signs, and tests. These are used to list a differential diagnosis, the first differential diagnosis step. This approach, while often effective, suffers from inherent limitations. Patients presenting with similar diagnoses, for example sepsis or community-acquired pneumonia, may have vastly different underlying causes, as well as different pathophysiological mechanisms called endotypes. This can lead to imprecise labeling and ineffective treatments. To truly revolutionize medicine, we need a more precise and personalized approach to diagnosis and treatment. The limitations of our current diagnostic paradigm are becoming increasingly apparent. As we delve deeper into the complexities of disease, we recognize the need for greater resolution in our understanding. The one-size-fits-all approach to treatment, while appealing in its simplicity, often falls short. To usher in a new era of medical progress, we must embrace a more nuanced and individualized approach to patient care. The second differential diagnosis represents a paradigm shift in clinical medicine. It builds upon the traditional diagnostic process by introducing a critical second step. This step involves a deeper dive into the patient's individual characteristics and the molecular underpinnings of their condition. By integrating clinical data with genetic information, lifestyle factors, environmental exposures, the phenotype, with the underlying pathophysiological mechanisms, the endotype, the second differential diagnosis aims to unravel the complexity of disease. This approach recognizes that two patients presenting with a similar diagnosis may have vastly different underlying causes for their ailments. For example, two individuals may present with a diagnosis of bronchial asthma. However, the phenotypes and endotypes are totally different. The second differential diagnosis seeks to identify these crucial distinctions. Central to the concept of the second differential diagnosis is the distinction between phenotypes and endotypes. Phenotypes represent the observable characteristics of a disease, the outward manifestations that clinicians typically use for diagnosis. Endotypes, on the other hand, delve into the molecular mechanisms driving the disease process. These are the hidden gears and levers that determine how a disease unfolds at the cellular level. This variability has profound implications for treatment. Understanding a patient's specific endotype allows for the selection of therapies that target the root cause of the disease. The second differential diagnosis, with its emphasis on understanding both phenotypes and endotypes, paves the way for truly personalized medicine. By identifying the specific molecular drivers of a patient's condition, clinicians can tailor treatment plans to address the root cause of the illness, not just the etiology. This targeted approach holds the promise of improved treatment efficacy, reduced side effects, and better long-term outcomes for patients. Envision a world where acute and chronic diseases are managed not through broad-spectrum medications, but through targeted interventions tailored to an individual's genetic predispositions, lifestyle factors, and pathophysiological mechanisms. This is the promise of the second differential diagnosis.